Hi, John. Thanks for joining today. I will go over what we found in your speech assessment data, explain what they mean, recommend one short follow-up test, and then show you an exercise we will start practicing. You mentioned that since your stroke, your speech feels slower and sounds a bit slurred. That's exactly what we noticed too. When we looked at how your mouth and tongue moved, the right side moved a little slower and felt weaker. This means the nerves that control those muscles were affected by your stroke. In the task where you repeated pataka as quickly as you can, your speed and precision were slower than typical. That tells us those muscles don't move as fast or strongly as before. In the task where you prolonged you reached about 15 seconds, a bit shorter than average for men your age. That means your breath support for speech doesn't last as long, and your voice may fade earlier in a sentence. When I listened to your speech, your voice sounded a bit breathy and soft, slightly nasal, and you seem to use extra effort to get the words out. This suggests that speaking takes more work because your breath support isn't strong enough to keep your voice steady through each sentence. All of these signs together show that the muscles you use for breathing, voicing, and articulation are weak and move more slowly. This pattern fits with a flaccid dysarthria, which is the speech change caused by damage to nerves that control your speech muscles after stroke. People with this type of speech pattern often sound slightly breathy or soft, may lose air through the nose, and produce some consonants less clearly. It's important to note that this affects only how your muscles move for speech, not your thinking or understanding. Your strengths are also clear. You understand everything well. That's really good. And you also follow instructions easily and stay motivated. These strengths will really help you make progress. To help us better understand how your breathing and voice work together, I'd like to complete one short follow-up assessment, where you hold an S sound and then a Z sound for as long as you can. In your earlier task where you held you ran out of air quickly, and your voice sounded slightly breathy, which suggests you may lose air too fast or that your vocal folds aren't closing tightly. The additional check will show us whether the main issue comes from breath support or from voice closure. It will also be an easy way to track your progress once we start breathing exercises. Based on everything we found, the first treatment I recommend is diaphragmatic breathing. The exercise strengthens the diaphragm, the main muscle and the ribs, so you can take a deeper, more controlled breath. In your speech tasks, your breath support was short. Your voice was soft and breathy, as well as speaking for longer periods is tiring for you, which means your lungs and breathing muscles aren't providing steady air for speech. Diaphragmatic breathing helps you take fuller, lower breaths and release air slowly, giving you better control and louder, clearer speech. Because your goal is to speak comfortably and confidently at work, improving breath support should make your voice stronger and less afterful. Research shows that diaphragmatic breathing exercises improved respiratory function in individuals post-stroke, which strengthens stronger breath support for louder, steadier speech. So it's well supported by evidence and directly matched to your needs. Okay, now let's try it together. Sit up straight, please. Put one hand on your chest and another on your belly. Okay, now look at my belly. Breathe in slowly through your nose so your belly moves out where your chest stays still. Just like this. Can you see here? Okay, now hold it for 1 second. Then breathe out slowly while saying a gentle, steady and try to keep the sound smooth and even. Okay, I will demonstrate it. Can you see it clearly? You should feel your belly slowly move back inward as the air leaves your lungs. Okay, now you give it a try. Well, as you breathe out, Think about controlling the air, not letting it rush out too fast. The goal is to make the R sound last a little longer each time. Okay, let's try it again. Good job! We will start with 5 of these breaths twice a day. Each week, we will check how long and how strong your R sound is to see your progress. That's all for today. Thanks for listening.